I
Anthony,
will.
again.
I will. Again, I'm Stuart Caillé, Director of Operations at Kelsey Seybold, also Vice Chair of Government Relations, but really enjoy this committee. And one of the reasons why I enjoy this committee is because I think we need to bridge ourselves more with academia. And I don't think we've done that well in the past. And so I really like working with students. I'm a former adjunct professor also at the U of H Clear Lake, teaching in the healthcare administration program. And so I'm very interested in this committee. I am introducing to you today Anthony Cole, who is in our HR department. Anthony is a former intern of mine. He was also, on a personal note, the third baseman when my son threw the first no-hitter at Clear Creek High School. And so he was sitting on third base when that happened, and I know he was excited about it as well as I was and my son. But Anthony's done a great job for us. We hired Anthony after his internship, and he has since sort of moved up the ladder a little bit. And so he's going to share a little bit of his personal experience, I think, later on in his presentation. But he's here today to give us just sort of an update of what's going on with Kelsey Seybold. And Anthony, I'll add some commentary when I see fit. Go ahead and add anything I missed, Anthony.
All righty. No, I've basically covered it all. This presentation, it'll be about, Kelsey Seybold's academic affiliations, kind of covers COVID and what we've done to prepare, what we've done to kind of overcome everything and the, you could say, the good that's come out of it. And so I'll go ahead and I will start sharing my screen, and we'll go ahead and start the presentation. All righty. Can everybody see this?
I do.
All right. Let me go ahead and all right, so like I said, I'm staffing coordinator at Kelsey Seybold Clinic. I started as an ASR 2 at main campus, the GI department, and now I am in the human resources department. I was a recruitment coordinator at first, and then slowly realized that I did nothing with recruitment. So we actually just changed my title to a staffing coordinator. So I deal with all the contractors at the 24 clinics that we have. So just a little background on who Kelsey Seybold Clinic is. We are a multi-specialty care with 24 clinics in the Houston area. We have 2 ambulatory surgery centers. Everything's outpatient. We do surgeries and things like that, but obviously all those patients are sent home the day of. We have just around 500 physicians. That's counting NPs and APCs, things like that. And so we're right around 500. Kelsey Seybold, our mission is to improve the quality and value of healthcare delivered in our communities. Obviously, with COVID going on and kind of overcoming that has been a big mission of ours. It's just something that we really focused on, is improving that healthcare, improving that for our patients and the communities around us, knowing that it's just so imminent that COVID is here and that we still had to, provide that health care for our patients. Provide our patients with comprehensive medical care through a preeminent multi-specialty group practice. We are multi-specialty. You're able to kind of a one-stop shop for all your healthcare needs. So you can go to any specialty primary care at any of our clinics. And we pride our staff with exceptional opportunities for professional growth. And that's kind of something that I can attest to, kind of moving up a little bit within Kelsey in a short amount of time, and definitely an amazing company that is there for you. Our values: patient care, customer satisfaction, honesty, mutual respect, supportive environment, creativity, and enthusiasm. And our HR team definitely has all that. We are, a close-knit team, and it's very fun, very enjoyable to work with the people I do. So just a little background on the COVID-19 trials, tribulations, and accomplishments. So, a big thing was how do we continue care while keeping our patients and our staff safe? That is obviously the #1 priority for a healthcare affiliation or department or, company to do. So we actually place over 50 health screeners at all our 24 locations. And I was the person to actually do that. We, just a little background on that, right when COVID was started, kind of spiking and everything, operations was like, we have to have people being screened. And so it came to me, and within probably a week, I staffed 50 people at all of our locations, getting with managers, supervisors, clinic administrators, some directors, and just saying, what are your hours? Some of our clinics have pharmacy that needs coverage. We have employee entrances, we have patient entrances. Our main campus needed 5 people, and then you deal with that. They're contractors. They're not all going to be reliable workers, and so we had to deal with a lot of backfilling those positions. So it was a big movement, and it was tough. It was fun. I enjoyed it because it kind of proved, hey, you can throw anything my way and we'll get it done. And I was able to do that. And till this day, I actually make the screener schedule. So I send it out every week on Friday morning to let all of our clinics know that they're going to have coverage. I still do that to this day. We also created employee exposure reports, and that's just exactly how it sounds. If an employee did have any symptoms, they would fill out an exposure report. So that way we can monitor who and who has not had the symptoms and things like that. Here recently, we got automatic temperature readers at our business office and some other clinics. I'm not sure, maybe Stuart knows what other clinics have them, but I know our business office in Pearland has it, and it's a pretty neat little monitor. You obviously would check in with an app on our phone, and it asks us the pre-screening questions, and then we walk in, or we show the screener, and then we walk in, and it's this little screen. It's almost like a tablet sitting on a tripod, and you'll just go up to it, and it'll take your temperature. I know everybody's probably has seen them before, and it tells you access granted. The quick funny story: I was covering the front desk, and I walked around, and I was in the motion of putting on my mask while I was walking by it to go to my office back in the HR department, and I was walking kind of slow, and it saw that my mask wasn't on. And so as I was kind of pulling it, it said, "Please put on your mask." And there was 5 people around, and we all looked back at it. Everybody looked at me, and I was like, "Did that thing just tell me to put on my mask?" And it was a funny little story, because I was like, "Man, these things have a brain of their own." And so it was neat. It tells you to come closer and things like that. I know everybody's probably had experienced one, but it was a little funny when it told me to put on my mask. So it makes sure that you have that thing on. We also telemedicine, and that's the new normal now, and that has just spiked. It's crazy how much that has changed in healthcare. And like I said, I think that's going to be the new way of medicine. And Stuart, I don't know if you want to talk about telemedicine, because I know that's big right now with Kelsey and obviously other healthcare.
I'll just make a brief comment, Anthony. All of these things that you're talking about are ways that we have changed the way we are doing business. So when you talk about, the screeners and telemedicine, the workforce is changing. And when you get down to the employee pools, also the new clinical processes, a lot of what we're doing today is different than what we did back in early March, before we had this COVID. So, think of that as Anthony goes through the rest of this process. But yeah, we went from 99% face-to-face visits to basically 15% in the period of about 3 days. And now we're about 85% face-to-face visits, with 50% being telemedicine, but definitely changing the way we do business.
Yeah, thank you, Stuart. And so we also, in one way, how to keep our employees working in an economic crisis, obviously with unemployment just spiking, back in the early days of COVID and everything, and how blessed we are to be in healthcare, to say the least, is just, how just crazy this what it did to our economy, and how grateful we are to actually be working in an industry that is always needed, which is one reason why I'm glad I went the route I did in school. But we also, Kelsey, we created an internal employee pool. So what this was, when employees had to be furloughed, you could say, or they just weren't needed for a certain amount of time, we created this internal employee pool, and it was, you would just put your name and, what your job was, and you went to this pool. And I think at one point we had about 400 people, 400 employees. And what they would do, if, let's say, our benefits department was, the phone was just ringing 24/7. They just didn't have enough people to manhandle it. It was crazy. And, that's obviously because of all the inquiries on, hey, COVID exposure, things like that. Am I going to be covered? If I go in and get a test, is that something I have to pay for? Anything like that. And so what we did is we created that pool where we could, the managers could pool people from that pool, and they could help out for a certain amount of time, and they would be paid. So that was one way to kind of assist our employees. We also had to backfill positions due to COVID exposure. So you can just imagine how many people would call in the day of and say, hey, I'm not feeling too good. I'm sick. I have a cough. I lost taste and smell and things like that. And so it really put a damper on business operations. It was very hard. We just implemented a VMS at Kelsey, which I helped, create. And it was absolutely insane. We're still getting so many contractor requests till this day. But during the height of COVID, it was call after call after call to get contractors to backfill these positions. And so we utilize vendors to supply professional contractors to assist our business operations. And that was mainly my doing in clearing contractors, since that is what I do. I am staffing. And and then with human resources, as you could tell, it put a hold on all our requisitions. I mean, during COVID, our human resources department, our recruiters, they couldn't hire anybody because everything was just, there was so much uncertainty about everything. Now things are actually getting back to normal. We are having, new employee orientations. We can only do so many. I think we can have a max of 28 people and things like that. So we're obviously still, abiding by the social distancing and things like that. But it definitely took it was tough. It was hard environment to work in for a lot of people during COVID, but it's starting to look a little bit more normal. So we're grateful for that. Our human resources team, this is our recruitment team. We have classified recruitment, and so we have a manager, 7 recruiters, 3 recruitment coordinators, and 2 staffing coordinators. Classified recruitment is everything and anything besides your doctors and your physicians and things like that. So you're talking RNs, MAs, all administrative positions, facility, IT, things like that. On the physician services team, we have a director, 2 physician services specialists, a provider services coordinator, and 1 provider recruitment coordinator. And they all deal with hiring doctors and physicians at Kelsey. And so on this slide, we have, these are all the departments within Kelsey. You'll be able to see the clinical side and the administrative side, and there's quite a bit. So with all the recruiters that we have, you can tell that putting a hold on all these requisitions during COVID was very hard to do. It was, it stopped kind of what we do. It stopped human resources and the recruitment side on their day-to-day duties. And so whenever you see the asterisk, it's I did that so you can see the hard to fill positions, or it's a special skill set needed, or it's just you needed additional coverage. And that was part of what I do. So with staffing, so all those asterisks that you see by the departments, those are areas that I have staffed for before. So our business development team, which is marketing, social media, things like that, they use quite a bit of contractors due to a special skill set. So or it's a hard position to fill, meaning, hey, we need this type of person, but it's going to be tough to find that right person that we need. So they'll reach out to me, they'll create a requisition, and then we'll get them a contractor to fulfill that need until either they can become a permanent employee, which actually happens quite a bit. We have the marketing department does transfer their converts their contractors to employees, which is awesome. But yeah, so here's all of our departments that we service.
Yeah, I think
we'll go ahead.
if I may make a comment right quick, Anthony, and that a lot of people think of healthcare as institutions as needing healthcare people, but one of the points for that screen is to show you that we need IT people, we need business people, we need marketing people, we need all sorts of skill sets that make this ship kind of sail the right way.
Yeah, there's a lot more behind the door that you don't see that make healthcare businesses run. It's crazy, and I was being in operations, being an ASR for 7 months. I only kind of saw it one way, like Stuart was saying. I didn't really notice what went on the back end, and it's incredible. And so yeah, it's a good point to make, Stuart, that all these positions, all these departments is what makes the healthcare make Kelsey go around and other healthcare facilities. So we'll go ahead and move on to our academic affiliations. We work with multiple academic institutions in the Houston area. Some of those academic affiliations, the title of them, we do medical. So we do medical schools. So that's for our doctors, our physicians, radiology, sonography. Man, I always struggle with that word. MA externships, pharmacy, high school administrative fellowships, and internship programs. And so with our medical school affiliations, we actually take in students who come from these universities, and they will shadow. It's basically it's shadowing a doctor. They come in and they actually will they will help the patient. So they'll watch the doctor for so long, and then the doctor will kind of shadow them to make sure they know what they're doing. They don't do anything extensive, things like that, but they definitely kind of do the check-in and things like that. So those are our medical school affiliations. We have radiology affiliations with Houston Community College and San Jacinto, and our polysomnography school. So we use Alvin Community College for that program. Our MA externships, I will say this is probably our biggest academic affiliation, our MA externs. So we use all these schools right here. Some of them we definitely use more than others. And I know I got some numbers from our recruiters, and we hire about 50% of the MA externs that we bring on. So these MA externs will come on, they will shadow, they will actually do hands-on things with the other MAs and nurses, and they will, 50% of the time we will hire them. So I think back in 2018 we had about 84 or so externs, and we hired about 41 was the number that we hired. So it's a great academic affiliation that can prepare these students for a job with Kelsey. Our pharmacy affiliation. So here are all the universities that we work with for pharmacy. And also, I'm going to go back to the radiology. The radiology affiliation. So with these schools, we have contracts with them. Sorry, I forgot about this part. And they will actually, the radiology students will come on to multiple locations at Kelsey. They will shadow for a day or two with a radiology technologist, and about day 3, day 4, they will do hands-on work in front of a certified radiologist, so somebody who has been at Kelsey for so long. And this lasts about 3 months or so, and that's also another big reason that we hire radiologists is from that program. And here are all our high school affiliations, kind of, the Houston area. And what the high schoolers do is they will, and I actually went to Clear Creek High School, and so I remember seeing a lot of these students, leaving midday and scrubs. And so what these high school students will do, they'll come in, and all they do is they just shadow. they shadow MAs, nurses, probably a few more positions. And they just shadow. They can't do anything hands-on, obviously, being in high school. And I remember interning with Stuart one day, and I saw it was either Pearland or Clear Creek. It was a maroon school. And I remember looking down, and I was like, I asked Stuart, I was like, are those high schoolers? And that was whenever Stuart, asked me to put this presentation together, it was funny because I was like, I remember that vividly when I was interning with Stuart, seeing high schoolers walking the clinics and stuff. So pretty neat. We also have an administrative fellowship. This is a program that hires one candidate, and I put hires in quotations, meaning they are paid. It's almost like an intern, a paid internship, and they shadow the VP of operations and day-to-day activities. So they go to leadership meetings. They go to all the all the big meetings that the VPs will go to. It's a one-year program, and it's a very good way to get hired on at Kelsey. And it's a great resume boost. And I know the last person who did it actually is now a clinic administrator for Kelsey at the main campus. I'll go ahead and talk about my personal experience on my internship. So I graduated from Clear Lake back in 2019. So last year, going on 2 years. I went to Temple College, a little background, went to Clear Creek High School, played 2 years of baseball at Temple College in Central Texas, moved back home and went to Alvin Community College for 1 year to finish my prereqs. After that, I decided to go to Clear Lake, stayed at home, lived with my dad, saved my money, and graduated with a bachelor's degree in healthcare administration. My last year, I had one credit, or my last semester, I had an elective credit that I needed to kind of fill. And I asked Stuart, hey, can I go ahead and intern with you? Because I actually found out that you can use that as an elective. Stuart was great, said, yep, come on. And, I learned so much being with Stuart, him being, in the operations side. I was able to see how the front of, healthcare is and what it takes. And when I interned with Stuart, I went to leadership council meetings and met the VP, met a lot of directors and leaders for Kelsey. I assisted Stuart in projects. I know I did the influenza presentations, things like that. Attended those leadership meetings, and it was a great opportunity to network with healthcare professionals. So actually, after I interned, during my intern, I met the clinic administrator for main campus for one of the floors. And he was an awesome guy. I actually sat down, talked with him for a few minutes, and just told him, my internship story, things like that, how I went to Clear Lake. And he was actually one of the people that helped me get my foot in the door at Kelsey. Besides the internship with Stuart, he was the one that reached out and helped me get my position as an ASR2 at main campus. And so very thankful for that. And if I didn't know Stuart, if I didn't have my internship, I would have never gotten that opportunity. I was an ASR for 7 months. After those 7 months, I transitioned over to human resources, and that's where I'm at now. And I'm looking forward to the future with Kelsey, and just what an awesome opportunity it's been, and how academic affiliations can really produce, great employees, and it's just a great thing for our community. So if anybody has any questions, please feel free, and Stuart and I will answer them.
Yeah, let me make one comment if you don't mind. Just actually 2 comments. First of all, there's a lot of different schools that we work with. You saw a list there in the different programs. And so, if there's something that you think that we can work with you with respect to a program you may have, then, by all means, reach out to Anthony. Anthony will give you his, or we can send out his email address to everybody. Maybe we can, maybe there's an opportunity there. And the other thing I'll say is that, there is going to be a new normal after this pandemic is over. And, the job skill sets are changing with respect to how we've changed the way we do business. And so I think it's important for us to migrate all of that information back to academia. so that you know, a lot of you could help, you know, train up that new workforce that we're needing. And so again, that's an area I'm very interested in and doing, being an educator, part-time educator myself in the past. So with that, Anthony, yeah, let's open it up for questions.
So, Anthony, are you just an anomaly because you knew Stuart, or it's not like you have to know somebody to get into the system? But tell me about the percentages of those applying versus the percentages of those that continue and succeed like you.
I will say, so, you know, knowing Stuart, definitely, he was my foot in the door and the opportunities that I needed. I think there's a couple other people that I know that Stuart, he didn't intern with, but he knew, and they're actually moving on, you know, moving up quite well. And so I will say, I think it's a lot on the person. And I think it's hard for somebody to stick their neck out for somebody who they don't know if they're going to work hard. If they don't know, hey, if I do, you know, push you into this department, or if I do help you get that, you know, step up into that next position or that promotion, you know, it's nerve-wracking because you don't know what if they drop the ball, what if they're actually not a good employee, what if, you know, you got the wrong, you know, the wrong kind of perspective from, and that does happen. But I think the biggest thing is just knowing that that person that you're vouching for is a hard worker and is willing to, you know, take that extra step to make them proud. Because that's one thing that I always try to do is, as an ASR, you know, checking in patients, I try to do everything I could to be the best person checking in that patient. And I was trying to make Stuart proud because I knew that, you know, him and the other person, the clinic administrator, really helped me get to that point. And I wanted to make them proud and let people know, like, hey, you know, this is a good worker. This, you know, you can trust this person.
Yeah, just another comment. You know, we don't hire every intern. I don't know what the percentage is, to be honest with you. In a lot of cases, we don't have a position. But you know, our first priority, our main priority is actually to help train people, whether it's for as a healthcare executive or a radiology technician or a pharmacy technician or a medical assistant, whatever it may be. So that's really our main priority. In not every case do we have an available position once that person completes their internship or their education. But certainly it's a great opportunity for us to be able to get to know a candidate and see if their skills are up to the level that we need.
I want to thank you all for letting our polysomnography, that's how you pronounce it, polysomnography students come and work with y'all. Yeah, greatly appreciated. And of course, you know, at the college over here, I'm over nursing, allied health, and the legal department as well. But we are, you know, always open for anybody that you have that would be interested in coming and sitting in at our advisory committees or being a part of it. We are always looking for industry partners. A question I have for you is kind of speaking holistically about all of the interns that have come in. If you could name one weakness that you would want us as academic institutions to make sure our students come out with or improve on, what would that be? I've heard soft skills, you know, professionalism, showing up to work on time, you know, various things like that. But what do you feel from your institution that you would want us to make sure that our students possess when they leave, aside from the skills for that profession?
I'll name one thing. Anthony may have a different take on this, and that's a very good question. I'm not sure I can really answer it accurately, but you said soft skills. I think the one thing that we see is in quite frankly, our younger generation is an entitlement syndrome. And you know, you still got to work for what you're going to get. And so I think, you know, to Anthony's point or a comment that he made earlier is that he really wanted to work hard and show, you know, Kelsey Seybold what he was made of. And that's our trial period. So I think it's helping those students maybe understand that, listen, just because you get the job doesn't mean you're going to, you know, excel. That's your opportunity to really shine. There's no better time to shine than when you first get that opportunity as an intern. You know, do everything that you can to show, you know, that organization what you can do. And then once you get hired on, you know, do the same. And so that would be one thing I would say. I don't know if Anthony has any other thoughts.
Yeah, no, I definitely think that's probably the biggest one is, you know, just like for me, just because I interned with Stuart, it didn't mean I got the job. Actually, I had a hard time. I had a hard time fitting into the ASR role because previously, you know, playing baseball, I didn't work. I worked for 2 years during college, but it was as a contractor in the oil and gas industry. And so it was using tools, hands-on tools, running ductwork. And so I didn't have that background, that I didn't necessarily have the background skills that they were looking for. And just for an ASR position, you know, that isn't a high-level position. It's probably one of the most important positions. But, you know, just to know, hey, well, even though I said I interned with Stuart Kai, I know him, I know this person, that still doesn't matter. You still got to show people that you have the experience, you have the motivation to work, and you don't rely on that. Because I could have easily said, you know what, you guys don't want me. I interned with Stuart. He's a director, you know, for the South region. Then I don't want that. But knowing, hey, this is, and knowing that it was a frontline position and not a high-level position, it was more so I could have said, okay, I'm going to check out. I don't want it. But it's just like what Stuart said, there's no entitlement to, you know, internships into these administrative or these academic affiliations that students go to. They still have to keep working hard to prove themselves. And, you know, I continue to do that till this day. And I've been with Kelsey almost 2 years. And, you know, you can't lose that. You can't lose that aspect about yourself.
Mario Lynch, you have any thoughts on that question?
Well, I agree, because I do a lot of hiring. I hire for various roles, from a director to lower level roles as well. And you're right, like Anthony said, you have to put in the work. Nothing is a given. We don't play favorites. So you know, you put in the hard work, you will get rewarded for that. And Anthony's done an awesome job. I work with Anthony. He's genuine. He puts in the work. He's just, you know, he never gets frustrated. You never see it. So those type of workers we're looking for, and like you say, we're hiring a lot. We're hiring a lot of younger individuals as well, and we want those individuals to be mature, understand. You know, we have a high expectation. So yeah, we're right. There's no entitlement, because I'm a part of the hiring team, and we don't take, you know, we make sure we are fair. You know, we look for the right candidate. That's worked thus far, and we're going to continue that process.
Yeah, I'd also like to add really quick on Mario. You know, with the younger generation, and I'm definitely part of that younger generation, that I see some, you know, some of people, like colleagues that I know and friends that I knew from high school and things like that, is you have to ride the wave. You have to start from the bottom. If you don't have that experience, you have to know that you're going to start here to get here. And so, and that's something I'm still doing. And I think a lot of people will get that job, will get that lower level job, and they'll get burnt out because they're saying, hey, I'm not making as much as I want, or hey, I'm not getting the recognition, and they'll just stop. And I think that's a big problem with our generation now, my generation and the generations to come, is they don't want to ride the wave for a little while. But I mean, I did it for 7 months, and a lot of people do it longer than that. And I was just lucky to, one, have the connections, and two, just kind of have the demeanor I have. And I think that's a big aspect, Stacey, is you can let students know that you're not going to start off at the top, and that's what everybody wants. That's what I wanted. I came in saying, hey, I interned with Stuart. I know these people. I have all these, you know, I have a bachelor's degree, but you still got to put in the work. And, you know, that's just that kind of the Mario's part, is you got to have that motivation.
Yeah.
Anthony, I have a question. I know that Kelsey is a very sought after employer. A lot of people want to work there. And I'm just curious to see, seems like you guys have a great career path, succession planning, training, and all of that. What is your turnover rate for staffing there? I mean, do most people stay? Or I know it probably differs based on the job responsibilities and titles.
Yeah, so I will say we do have, I wouldn't say it's high turnover for our clinical positions. So we use probably 80 to 90% of our contractors are clinical positions. So your MAs, RNs, LVNs, and things like that. Obviously, that's the forefront of healthcare. And with COVID, with all the exposures and everything like that, we've had to place a lot more. I would say for every five contractors that we hire, we have to replace 1 to 2. And that's due to either an exposure. So prior to COVID, it was, I mean, I would usually never have to, replace a contractor if a clinic needed one. And now, I would if there was some disciplinary actions that had to be taken or somebody just wasn't a good worker. But now, just with COVID, it's a little higher. And those are those clinical positions. And as I was saying earlier, just you don't know who you're going to get. These managers, they do phone interviews, but it's hard to tell, hey, is this person going to be able to do everything that we need? We had one contractor in MA who was awesome, like amazing, did her job so well, but she wouldn't stop talking to her boyfriend while on her lunch break, but she was sitting in front of her computer while the doctor was still in clinic. And so you get things like that, like what a great worker, but just doesn't have that personal skills to know, hey, I probably shouldn't be on my phone, or didn't even step to the back or the break room or anything like that. So you get things where you can't control. For our marketing department, I will say we probably hire, and Mario may be able to attest to that, probably 80% of the contractors that we place, I see become employees for Kelsey.
Hey, to your question, I don't know the percent or the actual percentage turnover rate. I have it somewhere, but it's going to take me too long to find it. Mario may have it, but it is relatively low. We do have a high retainment rate for the most part. Part of that is benefits, part of that is quality of life, and part of that, there's some differences department to department, but I can get that specific number for you and then email it, maybe email it to you later.
And I can speak on the professional side as well. A lot of the roles, IT, finance, HR, marketing, there are tiers. So there's a career progression ladder where you have opportunities to move up. So you're not stuck. You haven't plateaued where you can't go any further. So we do have a lot of opportunities for the employees to move up, and that's great.
Well, if it's low, obviously, I guess if it's low, that's a good thing. You guys are doing something right? So that other employers should follow. Just to, as a comment, one of my other private clients, what they do to get rid of the entitlement syndrome, every year or maybe every 2 years, you have to reapply for your job. I don't know how that will work. So that you have to actually apply again to get your job, to keep it.
Interesting concept. I like it.
Thank you so much, Anthony.
Yeah.
It sounds like you're a hard worker, and you have a great future ahead of you, no matter where
I
you go.
appreciate that.
So
Thank
thank
you.
you